Hello and welcome to Psyched, the show where we explore psychedelics through social, economic, and political perspectives. Next up, we have Johnathan Dickinson. Johnathan is a counselor and consultant who has been working with Iboga and Ibogaine in both clinical and ceremonial contexts in Canada, Mexico, and Costa Rica since 2009. He currently resides in Tijuana, Mexico, and has a private practice called Ceiba Ibogaine Therapy, supporting people through the Ibogaine treatment process. He previously served as the director of the Global Ibogaine Therapy Alliance, during which time he led the development of the clinical guidelines for Ibogaine-Assisted Detoxification, a risk management guide that remains a standard in the field. He organized several conferences on Ibogaine therapy practice and safety protocols and has collaborated with researchers in multiple disciplines, publishing peer-reviewed work and presenting at numerous conferences internationally. In 2014, Johnathan was initiated into a Dissoumba/Fang tradition of Bwiti in Gabon and remains actively involved with both clinical and ceremonial approaches. Johnathan, thank you so much for joining us and welcome to Psyched.
Hey, super happy to be here. Thank you. I'm not sure how many people here have heard about Ibogaine before, but my sense is that as this whole upsurge of information about psychedelics is coming to the fore, more and more people have heard about it. So I've had this opportunity to be part of this shifting landscape that we've seen over at least the past 10 years. And I mean, you mentioned some of the projects that I've been a part of. And these days, focusing back again on what it's like for people going through treatment. So I'm gonna focus on what I'm calling Ibogaine-assisted recovery, which is different than what you mentioned. The guideline that we set before was for Ibogaine-assisted detoxification, which is a very narrow sort of window of time right around that moment when people are taking Ibogaine. Ibogaine-assisted recovery for me is looking at what happens after that. Where are people going? What kind of resources are available for people? So, so like you mentioned, the clinical guidelines work that we did was really responding to, like prior to 2016 when this was published, there was a manual for Ibogaine therapy that shared information that was really being used by like peer facilitators that came out of work that was happening within drug user unions and underground in different places. And it really focused on sort of helping people be comfortable and getting people, set up enough to, have an idea about what they were getting themselves into. But this guide was the first time where we put down on paper and mentioned anything even about cardiac screening, which is something that has been so basic to safety protocols for a really long time. There's a lot more that goes into this guide. If anybody is curious about it, I think it gives a pretty good idea about how to prepare for coming with different substances. And it talks about inclusion exclusion criteria and different sort of things to think about when you're looking for a clinic too, even. So that guide is available online. The link is right there, ibogainealliance.org/guidelines. So I want to start assuming that a lot of people here have at least a basic understanding of what Ibogaine is and kind of leap right into this question of, does it work, which is a pretty common one. And it's sort of the main reason why we end up talking about it, is, does it work? Does it help people get off of opiates? Do people stay off of opiates? This is sort of the big question that is the spearhead through which Ibogaine is moving into the culture and the cultural dialogue. So for me, it's really important to frame this discussion about treatment, because as people are getting excited about psychedelics moving into the culture and sort of have their own experiences that they'd like to see reflected back into the culture, I've even seen to the point of companies that are either setting up Ibogaine clinics or hoping to develop it, sort of presenting it as this possible solution for the opioid epidemic, or for the overdose crisis, or for generally, you know, problems with drugs in society. And I think it's really, really important to frame treatment as, first off, not everyone who uses drugs develops an addiction, obviously. Not everybody who becomes addicted needs treatment. There's many people, there's lots of documentation about people who sort of progress out of problematic substance use naturally. Of those who do not progress out of it naturally, not everybody wants treatment, and it might not be appropriate for a bunch of different reasons in a bunch of different contexts. And I think that's important, because when we're looking at quote unquote solutions to some of the problems, a lot of the things can be addressed by promoting harm reduction and safe access, and more deeply, the systemic issues that have driven the drug war, which is from day one has been racially motivated. From the earliest laws and policing measures and everything has been issues of race and class. So I think that presenting Ibogaine like it's a solution to all of these problems is extremely naive and should be avoided at all costs. Now, of those people who do want treatments, I think that there should be a variety of appropriate, effective, and well-supported options. So that is kind of where we can come in and start to talk about Ibogaine. And for those people who take it, does it work? So I'm gonna cover just some of the observational research that's looked at the results that people have had going through treatment in the existing unregulated framework, that especially in Mexico, but also in other places in the world. So this study that was funded by MAPS looked at 30 patients treated for opioid use in Mexico. And they showed what a lot of people are familiar with. It reduced opioid withdrawals. More concretely, 50% had no opioid use within the first 30 days, and that is not a single use. Okay, so 33% no opioid use at 3 months. And they're looking at, every study is gonna measure success in different ways. So that's why I'm trying to break it down, because a lot of times I see these numbers thrown around and it isn't really clarified. And there's a lot of other indicators here that show sort of improvements with family and social relations, psychiatric status going down, improvements with things like legal issues, and all those kinds of things. So there's another study, also funded by MAPS, looking at 14 subjects who were treated for opioid use in New Zealand, also showing a reduction of withdrawals. They had, in this case, 50% of their subjects saw 1 year of abstinence off of opiates, which is extremely significant. 80% overall reduction, that's across the board. Looking at all of the ASI drug use scores for all the participants, there's an 80% overall reduction in the ASI drug use scores. The ASI is the Addiction Severity Index. Let's see, there's another study here by Davis and others. This was a private study of 88 patients who went through a treatment facility here in Mexico. 80% of people reported elimination or dramatic reduction of withdrawal. And that's important because that number is not 100%. I think it's really important to stress that. and also 50% reported reduction of opioid cravings. Again, not 100%. 25% reported a reduction of cravings that lasted for at least 3 months. I mean, when people are coming sort of with this expectation that it's going to be this one night kind of immediate shift, it is for some people, and those stories do kind of rise to the surface, but it doesn't happen for everybody, and there can be a lot of other important factors that you can bring into the process to help support that. But these results are hugely significant when you look at like other available treatments. So they saw 41% self-reported abstinence at 6 months. Now, just to compare this, Brown and Alper in their study drew some stats from other research. And so there's one that looked at people who went through a buprenorphine taper, so using Suboxone and then in gradually lowering doses. They showed an 8.6% success rate, and they defined that as people who used other opiates other than Suboxone for less than 4 days within the last 30 days. So they're not looking at 100% abstinence from any opiates. Another review of opioid maintenance showed 18% abstinence at 1 month with buprenorphine, 26% with methadone. And when they're looking at abstinence, those are people that are taking those maintenance drugs and no other drugs in the same period. So again, comparing that with Ibogaine, we're looking at 50% self-reported abstinence at 1 month, according to Brown, 33% at 3 months, and then 30% self-reported abstinence at 1 year by Davis and others. So that is very significant, especially when, I mean, it's important to qualify as much as possible some of the data, because like the numbers here that Brown is showing, they counted people who went into long-term treatment programs afterwards as lost to follow-up. So those people are not even included in their long-term results. They also showed people who went into a buprenorphine or methadone maintenance program as people who used opiates. So again, for those people, landing in one of those programs might have been a major improvement in their situation and not for them considered a relapse. It might have been like hugely stabilizing for their life, but they're not factored into this, these final results. So these are pretty well as conservative of estimations as you could give those kind of, that data. There's one more study that I think it's really interesting to highlight. This is by Schenberg and others from Brazil. They looked at 75 people who went through treatment for alcohol, cannabis, or stimulants. Most of the people were going through for stimulants, crack, cocaine, or I think there's a lot of use of cocaine paste in Brazil. So a lot of their patients were using those stimulants. They showed 29% abstinence after the first treatment, and that's at 1 year follow-up. That's very significant. Another 23% used once during that period and then remained abstinent. So this is like really high rates. What's really interesting about this is that they went and offered people multiple treatments if they wanted them. So you can see the kind of progressive success that people had if they went through 2 or 3 or 4 or even up to 5 treatments. So if you add up at the end of 1 year follow-up, they showed about a 66% abstinence rate for people who finished the 1 year follow-up, although some of them needed more than 1 treatment. So what are some lessons from this research here? And again, like some of the research that's happening right now, it's less exploratory and more like just demonstrating things that we already know very well from working around it, but it's helping to kind of clarify and contextualize it for others. So this is something that I think gets lost in the news reports or the sort of flashier discussions about ibogaine. It's important to be prepared for some discomfort. Ibogaine, it's not the easiest experience to go through, but it can provide a huge amount of relief, even though it's not taking away 100% of the withdrawals. So some people go through more of the withdrawals than others. And, you know, I think what's become really interesting for me is looking at people who use opiates, especially as a way to manage their biorhythm and sleep. And so afterwards, when people are not using anymore, we're having to sort of discover together what are some other ways of trying to help to manage sleep. That's especially during the period right immediately after treatment, and usually things sort of progressively get a little easier. But these are all things that really require other kinds of support going through. Again, we're currently, a lot of the treatment programs are really just basically set up as a detox. And a lot of times in the United States or elsewhere, when you're going into a treatment program, if you're looking at going into a detox program, they won't take you unless you kind of have a plan for afterwards, like you're going to enter into a treatment program, because a detox on its own usually doesn't show these kinds of results, not even close. And then one of those supports can be potentially more ibogaine. You know, I mean, there's people that have come up the road for another treatment, but there's also a lot of people who find benefit in being able to work with smaller doses, booster doses. A lot of times it's a little harder to find than other psychedelics. I know I talked to a lot of people that start microdosing mushrooms or working with some of these other things that other people are talking about here today. But myself, I've been very focused on ibogaine, and I think that, you know, I've seen so many people have benefit from learning how to work with it and have some kind of a relationship with it, especially during that period right afterwards, even if it sort of slows down and fades out of the picture. So one of the tools that I use to kind of help to frame the long-term process is this model that's called the stages of change. And it's, it came out of the research of Prochaska and Di Clemente, who, you know, this is something that they use in smart recovery. It's one of the tools and frameworks that they present. And it's looking at how people who managed to make long-term changes arrived at where they got to. So for most of us, if we're looking at making some change in our life, we start in this phase of pre-contemplation, which is we don't even really necessarily think that we have a problem. And maybe we don't. Maybe it's not really demonstrating in our life very much at some point. And then maybe we start to realize or get some reflection that things are not really working out exactly the way that we hope or that they were before. And so we start to think about making a change, maybe what that change might look like, and we sort of enter into the planning stage. And most people, when they come into ibogaine treatment, are just, maybe they haven't really done very much planning at all, but regardless, it's sort of like one of the first action steps that people are taking. So when I can, I like to talk to people about starting to take action steps well in advance of doing ibogaine to stabilize and prepare. But regardless, when Prochaska and Di Clemente were outlining this model, they showed that most people who make these long-term changes, they have this really consolidated action period that's at least several months. So I think it actually lines up really nicely with the ibogaine experience, because a lot of people after treatment describe this period of this kind of glow where things feel easier. they feel lighter, there's less cravings. That's reflected in some of the research. There's a period where people generally feel a lot better. Sometimes that feeling kind of starts to fade. In recovery lingo, we talk about like a pink bubble that kind of starts to eventually dissipate. So what I try to talk to people about, one of the traps that you can come into with Ibogaine that you can't necessarily find by just walking into a 12-step room and white knuckling, is that right away you start to feel like, wow, this is how I've always wanted to feel. I feel amazing. And you start to feel like it's over, like that this is, you know, this is my life now. And what is most effective is taking that period of a couple of months and taking more action steps. So really focusing on building systems of support. So the final phase is moving into this period of maintenance. And they talk about, look, even people who like quit doing something and they're like 15 years up the road, there was this period of action and then this maintenance period where they really had to like make use of everything that they set up for a couple of years. So that is where I have started to focus with people on mostly. It's intensively during that action period and then setting things up so that people have something to kind of maintain. This is my practice. It's called Ceiba Ibogaine Therapy. And so I do that one-on-one coaching with people. There's a couple of ways that we'll try to engage with people. I mentioned there's some resources for helping people prepare for treatment. One of the things that is useful for people is well, especially for people that have been on buprenorphine or methadone, is that you can't necessarily go straight to the Ibogaine clinic and take Ibogaine. You have to switch onto a shorter acting opiate so that those long acting medications have time to get out of your system and the Ibogaine can be as effective as possible. So, and a lot of people, I mean, if you're in Canada, you actually have access to short acting medications in a lot of cases that your doctor can prescribe you. But in most places in the States, that's not the case. And we have this option of being able to work with kratom and with other kind of detox aids. And so one of the things I do is help people prepare for treatment that way. And then we can do a lot of other kind of pre-treatment preparation so that people are as stable as possible. And then I also work inside of a couple of clinics here in Mexico, and we kind of do this case management and aftercare planning. And then with some of those people, I'm kind of working on coaching them through afterwards and building up that support. In some cases, we're talking about how to use Ibogaine boosters. In some cases, we're looking at other tools, other nutritional plans, other recovery tools. Offer a weekly support group that's smart recovery based for people after Ibogaine specifically. And there's more and more programs and resources that are becoming available for people that are using psychedelics. Another one that's grown up a lot recently is called Psychedelics in Recovery. And it's people from all different 12-step programs who have begun to make use of psychedelics as part of their recovery and even as part of working the 12 steps. So they, you know, it's gone from like 2 meetings a month prior to COVID situation to now, I think 7 a week. There's a lot more resources and community growing up around people who are using psychedelics during recovery. So that's a little bit about what I'm doing now. And this program is constantly developing. The website link is right there, and there's a bunch of other resources on there. One thing that has become more relevant recently because of this whole pandemic situation is that, you know, because a lot of people have had to travel outside of the United States or Canada for treatment, some of the clinics have closed or shut down. at least temporarily, or if they're reopening, it's going to be sort of on a limited basis. And so I've been talking with a lot of people about home detox. I don't recommend people trying to take Ibogaine at home for the same reason that I helped put together the clinical guidelines for safety stuff. So on my site, there is another post that it's pretty thorough, looking at a whole bunch of other things, other tools that people use to help to manage withdrawal. And they're the same tools that we use post-Ibogaine to help to manage post-acute withdrawal and cravings and that. But there's detox protocols for those as well. And that includes like high-dose vitamin C, other herbal mixtures that kind of help people to maintain sleep during the withdrawal period and stuff like that, which is one of the most kind of crazy-making things when you can't sleep and that. So if it's useful for you or anyone that you know, I recommend checking out the resource section on the page. And I think I'll just leave it there for now. And I don't know if there's any questions or anything, but happy to talk more.
Hey, Johnathan, thank you so much. Really appreciate the time and perspectives. Let's just start out with an audience question. The question is, do you know anything about Iboga being an antifungal, something that can kill systemic candida?
Unfortunately, I don't know if I have much information about that to be able to comment on.
Yeah,
I've heard of people having all kinds of major, like, systemic benefits from taking it. I've heard, like, the most maybe relevant thing is people with, oh shoot, Lyme disease and it helping to, with that kind of thing. So, but I don't know.
Mm-hmm.
There's definitely all kinds of other uses. I mean, I'm focusing so much on recovery, but there's people that are taking it for like Parkinson's disease, and I'm more familiar with those with sort of neurodegenerative disorders. I've worked with people that have like fibromyalgia or multiple sclerosis or these kinds of things and seeing benefits for that.
Mm-hmm.
But fungal, no.
Many other psychedelics and their followings have an approach to therapy that also sometimes brings together multiple individuals at once, kind of community-based retreats, things like that. Is that something that's seen typically in Ibogaine, or it's just not as common? And if not, why not?
Well, I mean, if you look traditionally in Africa at how Iboga is administered, you'll see a very similar thing. It's a lot of focus and attention on a very few people who are taking the medicine and going through the treatment. In that context, there can be a huge group of people, like it's like the whole village, and people from neighboring villages come, and it's a big party. There can be like 60, 70 people there while 1 or 2 or 3 people are doing the treatment. And I think that part of the reason why you see that intensive focus is just because of how much care goes in. So, I mean, in the clinical space, there's a lot of medical supervision that has to happen that you just don't have with ayahuasca or mushrooms. But I mean, in those traditional contexts, a lot of the other people there would be taking smaller doses, just not larger ones.
Mm-hmm. Gotcha.
So
and with kind of traditional practices, you know, ayahuasca has this song of the healer that can really help guide the journey. I've heard some things about, you know, I'm very kind of Ibogaine and tradition naive. I've heard some things about, you know, drums being used throughout ceremony. I've watched some little snippets of documentaries, things like that. I was hoping you could dive a little bit into that and paint a bit of a picture there.
Sure. I mean, it is relevant to the clinical practice too, because a lot of times when people are going through detox, they're playing traditional music. It's not always the case. Mm-hmm. But generally in Bwiti, there's sort of 2 main instruments that people use during the experience. One of them is a mouth harp that has just like, it's like a monochord that has like a wobbly sound to it. And then there's another instrument that's like an 8-stringed harp. And usually during those experiences, the percussion is like shakers or smaller things, clapping. It's rhythmic, it's polyrhythmic, but it's lighter. And then usually what will happen is after that, a day or 2 days or 3 days later, then they'll bring like larger drums and kind of, it's more like when people are trying to return to their body and try to get back into movements and bring the energy back up, is when they're bringing heavier rhythms.
Definitely. Well, we do have to move on to our next few speakers. They'll also be talking about Ibogaine. So thank you so much for joining us, Johnathan. Really appreciate it, and looking forward to chatting more soon.
Okay, thanks again.
Yeah, be well.